Remember to subscribe to our YouTube channel at NDN TV Nigeria. Click on the subscribe button and be the first to get notification.
Medical practitioners and healthcare providers have called on the Rivers State government to revamp moribund primary and secondary health centers in parts of the state outside its capital city of Port Harcourt. This follows a skewed distribution of health facilities that continues to affect quality of life in communities located outside Port Harcourt, as our correspondent reports.
Rivers State is a major oil-producing state in the Niger Delta, where host communities outside Port Harcourt have been the worst victims of constant oil spillages and gas flaring by multinational oil companies. Over the years, the negative externalities of crude oil and gas production have seriously compromised public health in host communities where chronic ailments like cancer and hypertension are on the increase. Unfortunately, most urban towns in Rivers State like Bori, AKUGHA, Degema and Boni do not have functional health centers to attend to rising cases of disease prevalence. On a recent trip to Boni, our crew discovered that the Boni Central Hospital had been in a state of dilapidation after many years of administrative neglect. From outside, it was easy to tell that the hospital had fallen into decay as its entire premises was covered with overgrown weeds. The state of disrepair was even more telling inside the hospital, where our crew was confronted with broken doors, torn mattresses and stench oozing from its conveniences. The environment was unsafe for human habitation, yet a few indigent folks who could not afford proper health care elsewhere had been compelled to patronize the Boni General Hospital at the time of filing this report. Some medical practitioners and healthcare providers are worried that mortality rates will continue to be on the increase in parts of Rivers State where primary and secondary health centers had been abandoned by the government.
In a situation where a general hospital cannot offer basic surgical services for pregnant women and other minor ailments, makes the people have to travel far to access these services, and a lot can happen in the process of traveling.
If you can't give emergency services, it's death now. Because if someone is having an asthmatic attack and you don't have salbutamol inhaler, let me not just use Ventolin as the brand name, to give, and you don't have a nebulizer to nebulize the person can as well pack up.
In November 2022, the Rivers State government commissioned the 26 billion naira Dr. Peter Odili Cancer and Nuclear Medicine Center in Port Harcourt. Ironically, health centers outside the state capital have been left to rot away. Dr. Ebienju Olaka, a gynecologist, calls for immediate revamping of health centers located in towns and villages outside the capital city, which have been at the receiving end of disease prevalence.
So we have to look for, ways to make sure that we have all it takes, the necessary equipment, tools, as it were, to give prompt, adequate, and timely, care to our patients.
Most villages and towns contending with disease prevalence as a result of dilapidated health system in Rivers State are host communities to multinational oil companies. Pharmacist Agboma Isomibe calls for the intervention of oil companies as part of their corporate social responsibility to their host communities.
It shouldn't be heard anywhere that you have a general hospital right there in Boni that doesn't have medication. The companies that, make money from that community should also, as a corporate social responsibility, look into it. They should do something urgently.
Under 8 years of the Nyesom Wike administration, development was focused on capital projects, most of which were sited in Port Harcourt City and Obiakpo local government area. Current Governor Similaye Fubara has been called upon to pay more attention to human development and declare a state of emergency in the health sector that has suffered untold neglect for many years.
Inside the Niger Delta,